What is anxiety? Anxiety is a natural response to stress, involving feelings of worry, nervousness, or fear. It can be a normal emotional reaction to situations that trigger stress, but for some people, it can become overwhelming and persistent, interfering with daily life. Anxiety is often described as a feeling of unease about an event or situation that may or may not happen. But when it becomes chronic, it may develop into an anxiety disorder. Types of anxiety disorders. There are several types of anxiety disorders, each with its own distinct features. Generalized anxiety disorder, GAD. Characterized by persistent, excessive worry about a variety of things, often with no specific reason. Individuals may worry about health, work, social interactions, and daily activities. Panic disorder involves recurrent and unexpected panic attacks, which are sudden surges of intense fear or discomfort. Symptoms of a panic attack may include a racing heart, shortness of breath, dizziness, and fear of losing control. Social anxiety disorder, characterized by extreme fear of social situations where the individual may be judged, embarrassed, or humiliated. This can lead to avoidance of social gatherings and significant distress in social settings. Specific phobias. These involve an intense fear of a particular object or situation, such as heights, spiders, or flying. The fear is out of proportion to the actual danger posed. Obsessive-compulsive disorder, OCD, involves persistent, intrusive thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, aimed at reducing anxiety. Post-traumatic stress disorder, PTSD, triggered by experiencing or witnessing a traumatic event, leading to flashbacks, nightmares, and heightened anxiety. Prevalence and statistics. Anxiety disorders are among the most common mental health conditions worldwide. Here are some key statistics. Global prevalence. According to the World Health Organization, WHO, approximately 1 in 13 people globally suffer from anxiety, making it the most common mental health disorder. US and UK statistics. In the United States, anxiety disorders affect about 40 million adults each year, which is roughly 18.1% of the population. The National Institute of Mental Health, NIMH, reports that 6.8 million Americans have generalized anxiety disorder, GAD, with women being more likely to experience anxiety disorders than men. Anxiety in children and adolescents. It is also a common condition in children. The American Psychiatric Association estimates that 1 in 3 adolescents will experience an anxiety disorder by the time they reach adulthood. Age and gender differences. Anxiety disorders tend to emerge in childhood, adolescence, or early adulthood. Women are twice as likely as men to experience anxiety disorders. Some research suggests that hormonal fluctuations, especially during puberty and menopause, may contribute to this gender disparity. According to Mental Health Foundation, 2021, 1 in 6 people in the UK experience a common mental health problem, such as anxiety or depression, in any given week. Anxiety disorders are the most common of these conditions. Generalized anxiety disorder, GAD, is one of the most prevalent forms, with about 5.9% of the UK population experiencing it in their lifetime. According to research from the National Institute for Health and Care Excellence, NICE, social anxiety disorder affects around 5.3% of people in the UK at some point in their lives, while specific phobias affect about 10% of the population. The COVID-19 pandemic had a significant impact on mental health, with anxiety rates rising during the lockdown periods. According to a report by the Health Foundation in 2021, around 25% of people in the UK reported experiencing high levels of anxiety during the pandemic, compared to 19% pre-pandemic. Despite the high prevalence of anxiety disorders, many people in the UK do not seek help. Mind, a leading mental health charity, reports that only around 50% of people with anxiety disorders seek professional help, often due to stigma or lack of access to mental health services. The NHS has seen increasing demand for mental health services, and waiting times for treatment, such as therapy or counseling, have increased in recent years. However, there are growing efforts to address these issues and improve access to care. Causes of anxiety. Anxiety is influenced by a combination of genetic, biological, psychological, and environmental factors. Common causes and risk factors include genetic factors. Anxiety disorders tend to run in families, suggesting a hereditary component. Those with a family history of anxiety, depression, or other mental health conditions are at higher risk. Brain chemistry and structure. Imbalances in neurotransmitters, such as serotonin, dopamine, and gamma-aminobutyric acid, GABA, can contribute to anxiety. Additionally, abnormal functioning of brain regions such as the amygdala, which processes emotions, can be involved. Environmental stressors. Traumatic events, abuse, or exposure to stressful situations, e.g., divorce, death of a loved one, financial struggles, can trigger or exacerbate anxiety disorders. Personality and coping mechanisms. Individuals with certain personality traits, such as those who are more prone to perfectionism, low self-esteem, or those who tend to overthink, may be at higher risk for anxiety. Medical conditions. Some physical health issues such as heart problems, thyroid issues, respiratory disorders, or chronic illnesses can cause or worsen anxiety symptoms. Substance use. The use of drugs, alcohol, or caffeine can exacerbate anxiety. Withdrawal from these substances can also trigger anxiety. Treatments for anxiety. Anxiety disorders are treatable, and there are several approaches to managing the condition, including therapy, medication, and lifestyle changes. Cognitive behavioral therapy, CBT. CBT is one of the most effective forms of psychotherapy for treating anxiety disorders. It helps individuals identify and challenge negative thought patterns that contribute to anxiety and replace them with more realistic and helpful thoughts. Exposure therapy, a type of CBT that helps individuals gradually face and overcome their fears in a controlled and supportive environment. This therapy is commonly used for phobias and PTSD. Medication, antidepressants, selective serotonin reuptake inhibitors, SSRIs, like fluoxetine, Prozac, and sertraline, Zoloft, are commonly prescribed for anxiety disorders. Benzodiazepines, medications like diazepam, Valium, or alprazolam, Xanax, are sometimes prescribed for short-term relief of acute anxiety symptoms but are not recommended for long-term use due to the risk of dependence. Beta blockers. Medications like propranolol may be prescribed to help manage physical symptoms of anxiety, such as a racing heart. Buspirone, a medication specifically used for GAD, with fewer side effects compared to benzodiazepines. Lifestyle changes and self-care. Regular exercise. Physical activity helps reduce stress hormones like cortisol and promotes the release of endorphins, which improve mood. Mindfulness and relaxation. Techniques. Practices such as meditation, deep breathing exercises, yoga, and progressive muscle relaxation can help calm the mind and body. Sleep hygiene. Poor sleep can worsen anxiety, so maintaining a regular sleep schedule and practicing good sleep habits is crucial. Support groups. Connecting with others who have similar experiences can be beneficial. Support groups provide a sense of community and help individuals share coping strategies. Diet and nutrition. Eating a balanced diet with adequate vitamins, minerals, and omega-3 fatty acids can support brain health and regulate mood. Avoiding excessive caffeine or sugar intake can also help reduce anxiety symptoms. In conclusion, anxiety is a common yet complex condition that can affect anyone, regardless of age, gender, or background. It is essential to recognize the symptoms early and seek appropriate treatment, as anxiety disorders are highly treatable with therapy, medication, and lifestyle changes. By increasing awareness and understanding, we can reduce stigma and encourage those who suffer from anxiety to reach out for help. None of this is anything to be ashamed of. We are all different, and we are all human. Seek out the help you need, and trust me when I say, it's totally worth it.